This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
Of COVID-19 have not gone away. If you have medical issues that need attention, it's still really important to get help. Here to tell us what Providence is doing to make their clinics and hospitals safe for their patients, we welcome Senior Medical Director for Providence Immediate Care Clinics, Dr. Anh Nguyen. Good to have you with us, Doctor. So,
hi, Ellen. Hi. Thanks for having me.
Yes. Why is it important to not delay medical attention or treatment right now?
At this point, we have availability for anybody who needs to come in to be seen for anything. And so I would just urge anyone that has any conditions that they're not sure of is to come either call their doctor or come in and see us.
And why is it important to not delay? Is it because things could get worse?
Things can get worse, or we can be missing something more serious that we're not aware of. And so we have had people wait a little bit longer and end up in a tougher situation than they would have if they would have come in earlier.
How are you making it safer for patients to come in?
Well, we are adhering to the social distancing recommendations, and so we are keeping patients 6 feet apart. If patients are concerned, they can also call their primary care doctor first and see if there's a way they can see them. Otherwise, they're always welcome to come into the urgent cares. We have universal masking at this time, so we're protecting all the patients as well as our employees with this process.
And when people come in, aren't they given a temperature check and that kind of thing too?
Yeah, we have screeners at the front of all our clinics and office buildings so that we make sure that no one's entering while they have a fever.
And I understand too that you have plastic partitions between different office spaces, if that makes sense.
Yeah, well, we put partitions in the front where people check in. That way, we're protecting our caregivers as well. Patients can really feel safe coming in at this point. We have lots of ways to deliver care safely.
And if you don't have a mask, you offer one for folks too who come in.
We sure do. We have plenty of donated masks from a lot of people in the community. And so if you are unable to have a mask or bring one in yourself, we do have some that we can donate for you.
Since I've been, and I noticed too that there are markings on the floor to keep people 6 feet away in case we don't know what 6 feet away is.
Yes. Yeah, we just got new signage on the floor. You know, you see them everywhere in the grocery store stuff, but that really helps patients have a visual of where they should stand to keep the other patients safe as well.
What are some conditions we should not ignore?
Well, I would say anytime you're unsure of what you're dealing with, feel free to come in. But for the ones that are really important not to miss is some things like chest pain or severe headaches, abdominal pain, fever. Any of those things shouldn't be delayed at all. But for any other concerns where people just feel like they're not sure of what they're experiencing, we have capacity as well as safety measures to make sure we can take care of those patients.
When COVID-19 first started, we were kind of getting used to understanding what was going on. We were told not to go into an office if we thought, or a medical office, if we thought we may have COVID. But now that's a little different, right?
Yeah, I would say we have testing availability now in Providence that we can test many people. And so if you're concerned about spreading it to someone at home or whatever, we have testing capability. We are moving more towards testing people that are mildly symptomatic versus before we were really just sticking with the moderate to severe people. And so that way we can get a better idea of who's sick out there.
Can you bring someone with you if you need help? If there's an elderly person, can that person bring someone to help them along the way?
Yeah, we really try to limit the amount of exposure to anybody.
Sure.
So unless you really need someone to be there with you, I would recommend that you leave those people at home unless they're absolutely necessary to come with you.
Is it a tough time right now for doctors' offices everywhere?
Oh, I think it's a tough time for the medical system across the country. we're trying to look up new ways and figure out new ways to deliver care in a way that we've never had before. And so it's a challenge for all of us, but we're stepping up to it.
You clearly are. Yeah.
Do it.
Doctor, thank you very much. If you'd like to find out more, you can go to our website at KATU.com. We'll have a link to Providence Health and Services. And we'll be right back with more AM Northwest. Don't go away. Thank you, Doctor. Appreciate it.